Hello everyone, my name is Luqman Siddiq and I am the coordinator of Alfaisal MedHub under the umbrella of the International Office at Alfaisal University, Riyadh, Saudi Arabia. I am honored to be your host for today. For those of you who don't know what Alfaisal MedHub is, it's an initiative under the umbrella of the International Office College of Medicine that aims at creating an online global community of medical students. Alfaisal MedHub Alfaisal MedHub covers a broad range of topics that are common to medical students all around the world. Our primary objective here at Alfaisal MedHub is to help medical students learn more about the career opportunities available after graduating, as well as the steps involved in pursuing them. Since medical students are always confused about the path that's ahead of them, Alfaisal MedHub's Career Guidance series addresses this challenge through the perspective of accomplished and experienced seniors. As you all are aware, we are now conducting the Career Guidance series KSA. CGS KSA will comprise a series of 8 talks that will chronologically guide you all through each step of the Saudi medical residency process and will allow you to take the necessary steps in your career towards a medical residency in Saudi Arabia. Our first talk today will be given by Dr. Abdulaziz Bakhshwin. Dr. Abdulaziz is a PGY1 surgery resident at King Fahd Medical City. He'll be giving an overview of the KSA medical residency. Dr. Abdulaziz, you can start whenever you're ready.
Okay, thank you so much.
Yeah, stop sharing the screen.
All right, so assalamu alaikum everybody. My name is Abdulaziz Bakhshwin. I'm an R1 general surgery resident at King Fahd Medical City here in Riyadh. And today I will be talking about several topics, starting with the overview of KSA residency pathway. Before I start, I would like to thank the International Office for this opportunity and their amazing work, صراحة. They have arranged all of this, career guidance series, and they did a fantastic job contacting, different speakers and making sure that the important topics are covered. So thank you so much for that. In this, brief talk, I'll just go and discuss, some brief topics. So, definition of residency and why pursuing residency in KSA. Just go over quickly the different specialties that are offered here in KSA, and then we will continue with the next sessions. So what is residency? Is basically a period of training in a specific medical field after you complete your medical school education. In any medical school, after you graduate, you become a general practitioner, a general doctor. You're not allowed to practice medicine in a specified field. For example, you cannot be a surgeon, you cannot be an internist. You're just a general practitioner. So after you pursue a medical residency, you become board certified in a specific medical field. And once you have this board certificate, you are allowed to practice medicine in that specific field. And so the training duration differs between specialties, differs between centers, differs between countries. And it's important to keep that in mind. Components of residency, basically, there are 3 components of residency here in Saudi Arabia. So there is a training program, and this is usually, coordinated by the Saudi Commission for Health Specialties. They're the ones that are, in charge of the program, in charge of the curriculum, in charge of the exams. So there's a training program. Then there is a training site. So the training program is coordinated by the Saudi Commission, and the Saudi Commission is in contact with different hospitals, different universities, and these hospital universities will carry out that program, which was coordinated by the Saudi Commission, which was queried by the Saudi Commission. They will carry it out. That's where the residents will go to the training sites, whether it's King Fahd Hospital or Shumaisi or Takhasusi. So these are the training sites. And there is a sponsor, and sponsor is very important because the sponsor is the one who's going to pay your salary. Okay, the sponsor can be the same as the same hospital in which you train, so the same as your training site, but it can be a different organization. So why residency in KSA? Acceptance rate is relatively high, so it's easy to get accepted. There is a large number of seats, and usually there is no need for a gap year after medical school. Sometimes there is a need, but most of the time you don't have to, work as, for example, as a TA or as a service resident after your internship, in order to be accepted. Most of the time, sometimes you have to, especially if you are pursuing a competitive specialty, but most of the time it's easy to get accepted, right after internship. Broad range of specialties. There are even specialties here in Saudi Arabia that are not offered, anywhere else in the world. For example, pediatric surgery. Saudi Arabia is the only place that offers pediatric surgery as a residency program. Excellent training centers, whether they are under MOH, the Ministry of Health. There are also National Guard hospitals, military hospitals. These are, big centers. They have a variety of cases. They have very, excellent mentors and doctors who are willing to teach. Familiar location, of course, and culture and procedures. If you pursue residency here in Saudi Arabia, you know the culture, you know the language, you are approachable to people, so it's not going to be hard for you to integrate into the health system. And of course, being close to your family and friends is a big bonus. Relatively good salary and a comfortable lifestyle. It's important to acknowledge that, during residency it's a very hectic lifestyle, and it's your right as a person, as a doctor, to be compensated for your work. So it's your right to look for the best opportunity. And here in Saudi Arabia, there are many, good opportunities in terms of salary and, comfortable lifestyle. Specialties, there are, as I said, there are many specialties. So medical, including internal medicine, neurology, psychiatry, pediatric neurology. Also, this is, not offered in other places. Pediatric neurology, family medicine, community medicine, physical medicine, emergency, so on and so forth. And also surgical. There are many surgical specialties: general surgery, cardiac, orthopedic, urology, ENT, neurosurgery, and the list goes on. So who, when, and where to apply? So any medical graduate can apply, whether from Saudi Arabia or from outside. You can apply, but of course the priority is given to Saudi nationals. So the chance to be accepted, if you're not, a Saudi national, is way less. It's sometimes even almost impossible, especially if you're looking for a competitive specialty, like, for example, neurosurgery or plastic surgery. So after you complete your medical school requirements, you can apply, and usually the application window opens in beginning of January or middle of January of the internship year, where, of course, there is a matching system which is designed by the Saudi Commission for the Specialties. There is a matching system in which you upload all your documents and you complete your application, and then the matching process occurs on that website. So the goal of today and the different talks that we're presenting to you is, inshallah, to keep you aware of all the different steps along the way, and inshallah help you reach your dream program. So we'll be talking about the application process and the deadlines. We'll be talking about how to utilize the internship here and how to maximize the benefits out of internship here, the ASMLE exam and the secrets of the ASMLE exam. And we're going to talk about sponsorships briefly. At least you'll be aware of sponsorships and how they work. And thank you so much. And I hope you will be benefiting from the talk today, inshallah.
Thank you, Doctor, for the wonderful presentation. It was indeed very beneficial. We truly value your experience and guidance. If anyone in the audience has any questions, please feel free to put them in the chat now, or you can unmute and ask your questions. We'll be starting with the next talk at 1:15.